Have you ever found yourself sitting at your desk, head in your hands, completely drained because of your period? The kind of pain and heavy bleeding that forces you to cancel plans, change your clothes constantly, and leaves you too exhausted to function. For generations, many of us have been taught to keep this struggle a secret. Aunts, mothers, and friends might tell you that severe cramps and heavy bleeding are simply the price you pay for being a woman. We learn to bear it quietly. But when your cycle stops you from living your life, it is not normal. When you are losing so much blood that you feel constantly weak, your body is sounding an alarm. Often, that alarm is pointing to a specific treatable condition, uterine fibroids. You do not have to accept suffering as a requirement of womanhood. Finding out what is actually causing this pain is your very first step to getting your energy and your schedule back. This diagram shows a healthy womb. Fibroids are simply knots of muscle tissue that grow in or on the walls of that womb. They are not cancer. They are completely benign growths. This chart shows how incredibly common these growths are, especially among women of African descent. Black women develop fibroids at a much higher rate, and often at a younger age than the rest of the population. So if your doctor tells you that you have fibroids, you are not broken. You belong to a massive shared sisterhood of women navigating the exact same thing. We can think of fibroids like uninvited house guests. Whether they cause a problem depends entirely on how big they get and exactly which room in the house they decide to sit in. Here's a map of the womb to show you what that means. Some fibroids are very quiet. They grow on the far outside walls of the womb, staying completely out of the way. You might never even know they are there because they cause zero symptoms. Other fibroids are loud. They grow large or push directly into the inner cavity, the area where your monthly period lining builds up. When these growths distort that inner lining, the womb has to work overtime to squeeze and shed it during your period. That physical strain is what creates the severe cramps, and the stretched out surface area leads to much heavier bleeding. And if a large fibroid grows outward instead, it takes up physical space in your lower stomach. It might press right against your bladder, making you feel like you need to use the restroom constantly, or create a heavy, bloated feeling. Your symptoms are not mysterious. They are simply the direct physical result of where these growths are sitting inside your body. Losing that much blood every single month takes a massive toll. It drains your iron levels, leading to severe anemia. That is why you might feel completely exhausted, no matter how much you sleep. And that physical exhaustion ripples outward. The sheer unpredictability of heavy bleeding can break your focus at work, strain intimate relationships, and chip away at your confidence. This brings up the biggest fear many women have: fertility. Having fibroids does not automatically mean you cannot have children. While they can sometimes create bumps in the road, many women with fibroids go on to have perfectly healthy pregnancies. These growths are driven by natural hormones, age, and family history. They are a natural biological occurrence, not the result of something you did wrong. Left unchecked, fibroids demand your time, drain your energy, and steal your peace of mind. If your period dictates your daily schedule, it is time to stop enduring it. It is time to see a doctor. You might be avoiding the doctor because you fear the only solution is removing your womb. Today, that is entirely false. Medicine offers a full menu of options. Medications can control heavy blood flow, restore iron levels, and even shrink fibroids. Alternatively, doctors use minimally invasive procedures to block the exact blood vessels feeding the fibroid. Without blood supply, the fibroid shrinks on its own, without major surgery. If surgery is needed, a surgeon can carefully remove just the fibroids, leaving the womb perfectly intact to protect your ability to have children. Or, if you want a permanent end to the bleeding and do not want future pregnancies, removing the womb remains a safe, definitive choice. You have choices. Your doctor's job is to listen, understand your life goals, and help you pick the exact tool that fits your needs. Extreme pain and heavy bleeding are not a life sentence. Nobody should ever have to tell you to just live with it. You are not alone in this, and you did nothing to cause it. Take the first step toward getting your life back and finding relief by talking to a healthcare professional. And if you know a sister, a friend, or a colleague who might be carrying this heavy burden in silence, share this message with them.